So let's start the discussion. Thank you for joining today's panel discussion on the occasion of International Women's Day. I'm Varun and I had the success team at Medland. Very warm welcome to each one of you in today's discussion. I extend my warm wishes to all the respected women who have joined the webinar today. On behalf of Medland, I wish you all a very happy Women's Day. As you are aware, Medlearn hosts a series of industry expert sessions to empower and strengthen the healthcare community through knowledge transfer session. Today, we are privileged to have our esteemed panel of experts from various segments of healthcare to discuss pivotal role of women in shaping the healthcare landscape. Thank you once again for being a part of this important conversation. On this note, I would like to invite Mr. Deepak Sharma, who is the CEO and co-founder of Medlearn, to open the session, extend his warm welcome to all the panelists and the participants. Over to you, Deepak.
Thanks, Varun. Am I audible?
Yes,
Yeah.
Deepak.
Okay. So, first of all, very warm welcome again to all the panelists, all the uh, members in the audience, and especially all the women. Uh, and a very happy Women's Day. I'm very privileged here to be talking to a very uh, select set, women involved deeply and passionately in healthcare, and on the Medland side, in healthcare and education and training. So I think those are the two big pillars of any society's progress, and we're very proud to have a strong association. Within Medland, we have a strong diversity ratio, and also we know we serve a sector, healthcare, which has on the positive side a huge contribution from women. The uh, the theme for this year's International Women's Day is invest in women, accelerate progress. I think another theme I heard was inspire inclusion. So I think both the themes are super relevant. I think as we look at uh, also specifically healthcare, the opportunities, the challenges, the progress has been significant, and I'm very eager to see what each of our esteemed participants have to say later today about the theme, which is inspiring inclusion, right? Oh, sorry, pioneering progress. Sorry, that's I think part of the accelerate progress theme. But I'm also sort of setting the uh, agenda open of what I feel strongly about. Uh, all of us have been obviously deeply touched by uh, the presence of significant women in our lives, mothers, sisters, significant others. Uh, I also have the unique, very privileged, having a lot of women doctors in the family who've contributed to healthcare. Both my sisters are doctors. One of my nieces is a doctor. Two of my other nieces are involved in healthcare in some other way. And I feel and I see it firsthand the amount of compassion, the amount of nurture, the amount of uh, very professional yet nurturing qualities they bring to their work, and not just as doctors, pharmacists, etc., but also as women. I think they make a special contribution by just being themselves. And that's also true of the thousands, maybe now 100,000 plus, learners and hospital employees that we have on MedLearn, and we see an overwhelming majority uh, as women who are making ongoing significant contributions. The flip side remains, there's a lot of work to be done, right? We would like to see many more healthcare CEOs, healthcare executive board members, decision-making roles. I think that's disproportionately low. There were some stats last year. There's 18% CEOs and 34% board members. I think that's also a bit of an overstatement. There's a lot of work to be done. There remains a lot of work to be done on within the healthcare sector on uh, you know gender pay parity as well. I think there's significant discount despite the overwhelmingly increased contribution. I don't sound again like a feminist, but I think we can't lose sight of the fact that in many ways, despite the overwhelming contribution, uh, I think we're uh, letting our women colleagues down in significant ways if we are not actively keep these things in mind all the time. On the healthcare receiving side as well, uh, India's our country's record in being able to deliver equitable healthcare to women needs a lot work to be done. There are lots of preventable, uh, diseases, mortality, which are specifically, affecting the women population, and it shows in the disparity India has vis-a-vis global statistics compared especially to other developed and developing countries. So both on the giver side and the receiver side, I think this is not a thing we should let go of. It's an occasion to celebrate the progress that we've made, but it's also an occasion to uh, ideate, interact, and resolve on a few things that will inspire inclusion, that will pioneer progress. I don't want to take much more time. I think there are many more interesting speakers, and Varun will introduce each of them in turn as they come to speak, and then there's a format for discussion and Q&A. So I want to be able to leave as much time for that rather than ramble on and on. So if that's okay, Varun, can I hand this back to you and invite the
Sure,
first speaker
Deepak.
on?
Sure. Thank you. Thank you so much, Deepak, for your insights and the welcome. I would request Subhashi to kindly play the Medland corporate video before we get into the panel discussion. Subhashi, kindly play the video.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
MedLearn is a comprehensive learning, training and skill development platform incubated at Impulsys in India for healthcare professionals to attain the right mix of content, learning and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with MedLearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. MedLearn, better prepared for better care.
Thank you so much, Subhashri. Once again, warm welcome and thanks everybody for joining. Time to start the discussion. I would like to invite our first speaker for today's session, Ms. Radhika. It is with great pleasure that I extend a warm welcome to Ms. Radhika, our esteemed panelist for today's discussion. As the head of learning and talent for Rainbow Group of Hospitals, Ms. Radhika brings a wealth of experience and expertise in learning and development within the healthcare sector. Ms. Radhika's journey in learning and development is nothing short of inspiring. With years of dedication and commitment, she has honored her skills to become a seasoned professional in her field. Her passion of empowering individuals and fostering growth has been evident throughout her career, making her a true leader in talent development. At Rainbow Group of Hospitals, Ms. Radhika has played a pivotal role in shaping the training programs and initiatives that empower healthcare professionals to deliver exceptional care. Her innovative approach and dedication to continuous improvement has helped cultivate a culture of learning and excellence within the organization. As we gather to celebrate the achievement of women in healthcare leadership, we are honored to have Ms. Radhika share her insights and experience with us on this panel. So, very warm welcome on behalf of entire team of Medland. Radhika. Over to you, and thank you so much for doing this for us. And I wish you once again a very happy Women's Day. Over to you.
Thank you, Varun. I didn't know so much about myself, but thank you. It is indeed gratifying and humbling to hear all this. I'd like to wish all my fellow panelists and all the women on this call a very happy Women's Day. I thank Deepak and the entire MedLearn team for inviting me, putting this together. There's been a lot of work that's happened. But I always like, as cliched as it sounds, I would like to also reflect on why does one day have to be celebrated with much ado for women, right? And then I think of the other side. At least we have a day to celebrate. The poor men don't even celebrate Men's Day in all glory, right? Well, some of the organizations have started celebrating Men's Day. I'm sure many of us don't even know when Men's Day is. And there is a Men's Day, by the way, which is November 19th. But having said that, it takes two to tango or multi people to tango, right? And I think we should say that in order to succeed, we are the yin and yang, as I say. And I wish to thank all the men in our lives, right, for giving us this prominence and helping us celebrate, being with us through thick and thin, and doing a good job of being our cheerleaders, if I can say that. So thank you again for this. And I also am truly honored to be in the august company of my fellow panelists, Ritika, Prachi, and Dr. Veena. And I'm very inspired to hear them as well. My topic today is about leading with grace and the influence of women leadership in healthcare, right? And I'd like to weave something that I've been thinking through ever since I wanted to speak on this topic. So I'm going to just tell you my experience as I grew up, and how the healthcare women have influenced me, and how today I see it in an entirely different lens. And I just want to share my experience. Not going to talk a little bit on statistics and stuff like that, but I just want to talk about my first tryst, if I can say that, with the healthcare professional, was obviously my pediatrician. My pediatrician many decades ago was Dr. Bhanumati, and she comes from she had a clinic by herself where all of my mother used to take us when we fell sick, or we had the stomach pain or any other wounds, etc. And I must say she had the Midas touch, or the magical touch. She just had to touch our hand, or just give us a jab, or just give us one dose of medicine, and lo and behold, we would all be in the best of health, right? At that age, 5 years, 6 years, 10 years, 11 years, it was sheer magic. And every time I would fall sick, I would just say, Amma, let's go to Dr. Bhanumati, right? And that's the magic that she had. So much about, I don't know what she studied, I don't know what she did, but that true care, love, and the way she used to welcome us, the way she used to talk about all and sundry as if she had all the time in the world. And I mean, just spend that time with us would make us feel so warm, right, as a child. As I grew up, I didn't study medicine or anywhere in the healthcare, but I'm a science person. But the fact is that closer to home, I did have my best friend is one of the leading gynecologists. Her name is Dr. Rubina Shanawaz, and she works at Fortis as a urogyne specialist, and she's really pioneered work in the area of robotics. So I'm so proud about Ruby and the work that she has done, and she's been a true inspiration for me, right? And today, and as I took the decision of joining Rainbow Children's Hospital a few months back, I was speaking to her and I was asking her, is this a right decision? I do not know whether I should transition, because we've seen women here in leadership positions in the IT enabled services field. I come from a very strong IT background in terms of learning and development, banking, the BPO industry, etc. But hospital is not something I have done. And she gave me a very nice perspective of how I should look at this role and what value I can add with my experience, etc. That still stays with me, right? So I'm going to just talk about this as pretty much having an evening out with friends, like a coffee talk with all of you, right? Here, just prior to joining Rainbow, I do have a few women in my in the sphere of science who have influenced me. And my previous organization was Syngene International, which was the research arm of Biocon. And who else from a healthcare standpoint than Dr. Kiran Mazumdar Shah herself, that I had an opportunity to work with and be part of the panels in which she was there, have roundtable, be part of the roundtable dinners that she hosted. From where to where, I mean, she started the organization about 40 years back with 10,000 rupees that her father loaned, and she just wanted to she wanted to create beer, but she ended up creating enzymes, and her story is just so inspiring, and to build this empire called Biocon. And even at this age, 70 plus, the aura that she carries, the way she can influence even the lowest level within the organization is my also inspiring. During the pandemic, I had a chance to see the work of another lady who I was inspired with, Dr. Soumya Swaminathan. She's the ex-chief of the the WHO, the World Health Organization, and the grace and charisma in which she led through the pandemic. Of course, she was beaten, and that's something I'll talk about as well. Women in leadership positions don't have it easy, right? She was beaten, and her words still reverberate, saying that the work does not and will not stop even after COVID goes, right? Very powerful. She led with grace. She had her moments of failure. She had her moments of success, which is truly inspiring. And to have a leader at the WHO from India was, a great moment of pride and joy, right? I work in Rainbow Children's Hospital, and I'm incredibly humbled to work with some of the best doctors over here, both men and women, and inspired by very many of them. In Bangalore, there's Dr. Praveena Shenoy, whose energy doesn't seem to amaze me, the kind of saris she wears, and still does, maybe 3 or 4 deliveries with ease in a day, and then comes and chats up with us in the lift. Dr. Matangi in Chennai, she's the lead pediatrician there, very down to earth. She could have a cup of coffee. She would come out to have a cup of, to have some bhajis with us, etc. And I wonder, they know so much, but yet they are so humble and so approachable. And where are we in that sense? They give birth to life. But coming to the point that I like the most, which is training and development, I just was in one of the session with one of our doctors, Dr. Vaishnavi Chandra Mohan. She's one of our pediatricians, and she was actually doing a session for our consultants, who are the people who are still in their internship. They're not yet doctors. And she was talking about how you should handle patients well. And I'm thinking here, she's a doctor, she's a pediatrician, and she still dons a hat of a trainer that I think I can do well, but she still has the suaveness in delivering a training session. So what can't they do, right? So many moments of truth from that standpoint when you work in this industry, and when you see the sheer power of women. Of course, we come with care, compassion. Those are all very etched in generally the women of the world. I think we operate with care, we operate with concern, empathy, sensitivity, thinking from all angles, ensuring no one is hurt in the process. And who better than the doctors to actually display that? And if it's a women doctor, it's even more better, right? Now, from a statistic standpoint, right, that we have about 29 to 30% female doctors in India. And out of that, the community that inspires me the most and I get influenced with is the nursing staff, right? 80% of them are nursing staff. And in my hospital, we do have about 90% of our staff are nursing staff. And hence the diversity is at a very healthy 57 to 60%, right? So that automatically comes in that range. But what I see is that in leadership positions, we don't see many women, less than 18%. But coming from an IT background, I think that's still better because we didn't have this kind of leadership ratio without the push, the dashboards, etc., that is going to move up. So let me spend some time in understanding and telling you my experience the next couple of minutes on the nursing community. I think it's a community that we need to develop. I think they have great leadership skills. I think as a leader myself, I get immensely influenced by this community. I happened to be in Delhi very recently where one of the doctors conducted a code blue session. It's a session on cardiac arrest to a group of nurses. And I saw this one nurse, I will not mention her name from a privacy standpoint, but she was asking the most difficult questions to the doctor with so much of confidence, with so much of, so much of wanting to know what are the answers, etc. Right? I'm thinking, why can't she be a leader? Right? Why are we relegating her work to a nursing job? Can she take on more additional responsibilities? I'm sure she can speak for her people. She can be an amazing people leader. And I just feel that, every nurse in her own sense is a leader. And I feel when I walk the floors and when I speak to these people, they work 9 hours, 10 hours, 12 hours, and I can't do the job they do. And I'm truly, truly inspired by the way, they operate restlessly, handling customers, I mean, as in patients and the mothers, especially who are always worried about their kids, especially in a pediatric hospital like ours. So I think leadership is not about leadership. Sphere of influence is not about only women sitting in the boardroom. I think there is a lot that we can understand. When we look around, one of the professors in one of the famous hospitals in the US says, Melanie Burks is her name. She says nurses are the backbone of every healthcare system in the world, and I cannot not debate on that, because that is truly what it is. And so huge respect. And I my last points would be that the influence that we can show as women is doesn't need a boardroom, really. I think the way our healthcare workers at the lowest level treat our patients is the true essence of how leaders work. They actually walk the talk. And like all patients say, people will never forget, like Maya Angelou said, right? People will never forget what you said or what you did, but they will never forget how you made them feel. And that is how our healthcare workers make our patients feel. And taking a bow to all these people, whether in the boardroom or not, that succeed in creating that sphere of influence. So with that, I will end. Once again, a very proud moment to be here and giving my 2 cents. Thank you so much, Deepak and Varun, for this opportunity.
Thank you so much, Radhika. And with your insights, once again, I'm convinced that Women's Day is not just a one-day campaign. It's something the power of women needs to be cherished throughout. With that, I would like to invite the speaker, next speaker for the panel discussion today, Ms. Ritika. So, a little about Ms. Ritika. Her remarkable contributions to healthcare technology have been very transformative. As the leader US user experience at Athena Health, she has played a pivotal role in shaping the way healthcare professionals interact with technology, ensuring seamless experiences that enhance patient care and provider workflows. Her dedication to leveraging technology for the betterment of healthcare underscores the spirit of innovation and progress that we celebrate today. Ms. Ritika's expertise in user experience design has not only improved efficiency within healthcare systems, but has also empowered providers to deliver more personalized and patient centered care. As we come together to recognize and honor the achievement of women in healthcare and technology, Ms. Ritika's presence adds immense value to our discussion today. Her insights and experience will undoubtedly inspire us all to continue pushing boundaries and driving positive change in our respective fields. On that note, with open heart, I welcome Ritika for the discussion. Over to you, Ritika.
Afternoon, everybody. So, uh, happy Women's Day to all of you, first of all. And I hope I'm audible. Just let me know in the chat if I, yeah, don't sound nice. So, um, today I want to talk about something really close to my heart. It's the role of women in shaping healthcare technology. but I might focus more on the technology. So excuse me for that. But before we dive in, let's do like a quick exercise. Yeah. Just like close your eyes. Unless you're driving, then please don't. But imagine a startup company that's making healthcare as accessible as any other app on your phone, right? So if you've got one in mind, just keep it there because I'm going to circle back. For me, women in healthcare means my mom, Renu, my mom-in-law, Lalita, yeah, my gynecologist, Dr. Anita, my physiotherapist, Dr. Survi and Dr. Prachi, my coach, Julene, and even my cook, Shweta, right, who cuts off my coffee after like 2 cups. Like if I've had many, she's going to cut me off. So they are my tribe. And I know they're not famous names, but they have a deep impact on my healthcare. And I think these are the unsung queens of our life. I hope the chat is open for everybody. Uh, since I have the mic, I got to say the names of my tribe. But if you all want to celebrate your unsung queens, please go ahead and put their names. I feel women in healthcare starts from our domestic sphere. Now, circling back to the question about your most favorite healthcare app, for people, I'm just going to repeat it again, just for sake of memory. Any app that has changed your life in the recent, or any technology like your wearable, maybe your glucose measurement machine, anything that has changes your life, if you think about it, just keep it in your head and let's picture how those apps or technologies came to life, right? So uh, for me, it is one app called Shred Scientist. It helps me track my calories. It helps me tracks my steps. It reminds me for, hey, drink water. Why didn't you exercise? And think about like, how did that app kind of came together? You would imagine that, hey, a group of engineers were having a cup of coffee and they were just exchanging ideas, getting pumped. They whip out their laptops, code and design, and show each other their, proof of concept. Then they go connect with an investor, pitch them their idea, show their presentation, and they raise money, right? And the question now is, who did you see in your mind? Was it a man who would look like Mark Zuckerberg with a hoodie? Or did you picture someone like me? Right? And that's the kind of conversation we have with my fellow engineer girls, that when we want to name some famous women tech leaders, we have billions of people worldwide, yet we face a glass ceiling, both in health and technology sector at leadership positions. This is changing, I mean, and we all have a role to play into sustaining that change. And as Mr. Deepak Sharma already put forth in the introduction, so I want to use this forum to share some awesome names so that when the next time a fellow girl asks you who is this amazing innovator and a technology leader in healthcare, we could have some names. In India, we have Shobita and Shaswata Narayan. They are sisters and founders of Vira Health, a platform that helps women with PCOS live better version of their lives. We have Achita Jacob, who is the CEO and founder of Proactive for Her. She makes healthcare accessible on WhatsApp. Globally, we have Radha Agarwal, Mickey Agarwal, and Antonia St. Dunbar, who are founders of Things. And they sold their company in $181 million, if I'm not wrong. And I love when Indian women make waves everywhere. So currently, right now, we are in company of exemplary women. Dr. Veena, we have Radhika, we have Prachi on this panel, and they're, I'm sure they're touching and transforming lives and healthcare in their own ways. So I guess next time when we are asked amazing women in healthcare and tech, now we have some names. So quickly coming back to let me like share my journey when it started for me. It was back in 2015. I got an opportunity to work with PH Aware Global Association. It's kind of an NGO in US where they're passionate about raising awareness on PH, which means pulmonary hypertension. It's a rare and deadly disease, and it affects the lungs and the heart. It's often misdiagnosed and misunderstood. And my role was as a product designer to say, okay, how might we create an app that could educate both the patients and their families on how to manage pH and track their often, deteriorating quality of life. It included topics like educating them on how the heart functions differently for a PH patient, what symptoms to look out for, how to cope with the condition of in your day-to-day life, and what are the myths related to the PH. Now, this was especially challenging as a segment of our patients are children, our kids with PH. They are 6-year-old girls, they are 11-year-old boys, and they wouldn't definitely were going to read long articles, sit in long sessions, or watch these videos that talked about complex jargons of heart and lungs and how it affects them. So it was only through empathy that and a patient-led product research, which basically means that we used to do a lot of pulse check with the users of the product to see that it made sense for them or not, that we were able to come up with a viable idea of game for learning app. To put it in like simple terms, a Duolingo kind of learning app for learning how to manage this chronic condition. And we used game theory to make learning fun and effective. We gave them incentives for acquiring new knowledge and limited their app usage to avoid exhaustion because their patients, they had a stamina only of 5 minutes of action and like a big rest periods of 2 hours. We also encourage them to spread accurate information and debunk false beliefs about pH on other platforms. And as a part of product research team at Athena Health, I continue to apply empathy to better understand the problem space at hand. I always, always, always bring empathy to every conversation I have, whether it's with the patients using the technology, the doctors accessing our softwares and tools to be able to helping their patients, or even my fellow engineers who are working on the solution, who are coding these softwares. I've experienced firsthand the power of empathy in healthcare. It has only amplified as as I became a wife, daughter-in-law, mother, and now a co-caregiver to my parents. I believe we women are the game changers in this field because we can bring empathy to the forefront of healthcare delivery. We can challenge the stereotypes that label empathy as a soft skill or a woman specific trait. It is anything but a strength. It is not a unicorn but a bull. This is words of Dr. Adrienne Boissy, who is also one of the thought leaders that inspire my thinking and patient experience and healthcare experience. She's a practicing neurologist with Cleveland Clinic, and there's another name. Uh, a women doctor turned into experience officer that we can share with our fellow engineers. Um, so, on a closing note, as technology continues to revolutionize healthcare delivery, there is a role that I feel we have as a society to play. And the role of women in shaping healthcare technology is not just about, representation. It's not about, it doesn't stop at that. It's about creating a healthcare sector that is equitable, where technology is a lever that women can easily access in form of education. They can access it in form of some software tools. They can access it in form of, training sessions, and they can access it in form of some opportunities, both on job aspect and otherwise. It also resides in small actions like letting our boys play with dolls, because it improves their social and empathy skills, and letting our girls play with Lego blocks, because it improves their spatial skills, which eventually helps them become better engineers, get better at physics, get better at engineering drawings. Those are some tough subjects. Um, and it continues with our support and encouragement when fellow women innovate and challenge the status quo. When I've heard, women around me say, huh, let's make this pacemaker better by connecting it to internet. And when they say, hey, let's use blockchain or AI to improve healthcare, and when they are founders and creators of app, we can also support them by downloading it, joining their research, giving them feedback, and they will only grow from it. So as we applaud amazing women who are making a difference in health, care technology, and healthcare, I want to say that all of us women who have joined us on this session, on this panel discussion, let's go in this era with a force for good, as a force for empathy, and be a force to be reckoned with. So that's all.
Thank you so much, Ritika. That was really refreshing and made me nostalgic. I remember I went in my childhood, I went with my mom to buy a toy. And I asked, my mom took two cars, and I asked her, Mom, why two cars? So she said, one for you and one for Sangita's daughter. And Sangita was my house help. And I was like, why for her? And she said, Varun, in your upbringing, one thing which I want you to very strongly understand is that if you want to learn about women empowerment, start with your own surrounding. So she never let
That's
us
amazing.
call her bai or servant, and she just made her speak to in a very respectful language. And if I used to clutter, and she was never supposed to clean my room, she was like, Varun, you are cleaning the entire house, but I will use her for only specific needs of the house. So thank you so much for bringing that. It should start with our own surrounding, and if we want to make this change, it should start within and from our own houses. So thank you so much for bringing that so
Oh,
beautifully.
welcome. Thank you for sharing that beautiful memory.
Thanks, Ritika. With that refreshing note, let me invite the next speaker for today's session, Miss Prachi. And before I introduce Miss Prachi, let us all congratulate Prachi for being blessed with a baby girl 10 days back. And I really appreciate her involvement in the session today, because in spite of that, she agreed and she said, Varun, I really want to speak for this session. And she was in the hospital when I called her. I wasn't aware. So, my heartfelt gratitude to you, Prachi, on behalf of the entire team of Medlearn and all the participants for doing this for us. So, Ms. Prachi, it is my distinct pleasure to extend my warm welcome to you. She is the Chief of Administration at Anand Surgical Hospital, Ahmedabad. Ms. Prachi's leadership at Anand Surgical, which I have personally witnessed on my trip to Ahmedabad. She exemplifies innovation and excellence in healthcare administration. Her visionary approach to effectively managing operations so well and clinical outcomes has not only elevated the standards of care, but has transformed the hospital into a beacon of success and excellence in healthcare industry. As a leader, she has demonstrated unparalleled dedication and commitment to her team, inspiring them to reach new heights of achievement. Her strategic vision and unwavering determination has propelled her team to a next level, fostering a culture of collaboration. Her guidance at Anand Surgical Hospital has thrived, achieving remarkable success in delivering quality patient care while optimizing operational efficiency. Her innovation initiatives and forward thinking strategies has set a new standard for excellence in healthcare administration, serving as a resource for inspiration for all. So, my warm welcome to you, Prachi. Thank you so much for joining in again, and over to you. Prachi, you are not audible. No, we cannot hear you, Prachi. Maybe if you can disconnect, yeah, the headphones.
So, am I audible now?
Perfect. Thank you.
Yeah. Thank you so much, Varun, and the entire team of Medloan for inviting me, especially because I have a baby girl now. I believe that women empowerment plays a bigger role. So,
True.
yeah, no, it's okay. Thank you so much. And I have been like hustling a lot, but this was something which I wanted to do, not only for the love of women empowerment, but also for my child to see that things need to be changed, and not only for my daughter, but also for my son to understand that accepting women moving forward is very as much important as it as seeing men with them. So, as a female hospital administrator myself, I understand firsthand that the challenges and obstacles women face in ascending to leadership positions within the healthcare sector. However, I firmly believe that these challenges present opportunities for us. The more we are oppressed, the more it thrives us to move forward and paves the way to a more inclusive and equitable future in the healthcare leadership. However, women have been the backbone of the healthcare, comprising a significant majority of the workforce. Whether we look at the nurses, 80% of the nurses that come to the healthcare background are women. But when we see when we move towards the CEOs of the hospital, or we see certain clinical departments, we do not find women as much compared to the men dominancy. No offense to men over here, but this is the truth that certain surgeons are always men. We do not find female as orthopedic surgeons or cardiac surgeons in the ratio compared to the women. Yet, despite our undeniable contributions, we continue to encounter the barriers that impede our advancement to leadership roles, whether it be gender bias, stereotypes, or systemic inequalities. These obstacles often deter many talented and capable women from reaching their full potential. But today, I stand before you not to dwell on the challenges we face, but rather to celebrate the immense potential and resilience of women in healthcare. By empowering women and dismantling these barriers, we not only enhance gender equality within our organizations, but also unlock a wealth of innovative ideas, diverse perspectives, and transformative leadership styles. So, women do possess unique qualities that are essential for shaping the future of healthcare. We are more empathetic, we collaborate more effectively, we communicate more effectively. All these qualities they enable us to foster inclusive cultures, drive meaningful change, and advocate for the needs of patients as well as healthcare professionals alike. But research consistently shows that leadership team do not yield more women empowerment and through superior outcomes including improved patient satisfaction, enhanced employee engagement, and better financial performance. By harnessing the collective talents and experiences of women in healthcare leadership, we can drive innovation, foster creativity, and ultimately deliver higher quality care to those we serve. So, how do we overcome these barriers and unleash the full potential of women in healthcare leadership? So, it needs to be a collective effort from all the leadership leadership data, that it begins with commitment to challenge the status quo. No matter where you belong to, it is important that you give equal importance to the women that are present. No matter what designation the women is, the women has to be empowered and the woman has to be accountable and given the leadership qualities for whatever work she is being doing, whether it be a nurse, whether it be an attendant, whether it be a biomedical engineer, whether it be a CEO. So every place you need to empower the women to stand up for themselves, take up the stands, do work what they need to do, be a better leader, be a better communicator. So that is how I feel that we can improve the leadership status over here. Thank you so much. And a
Thanks.
very happy Women's Day to everyone.
Thank you so much. Thank you so much, Prachi, for your valuable insights. With that, let me invite very cute panelist for today's discussion, uh, Dr. Veena Acharya. So, Dr. Acharya's exceptional expertise and dedication to women's health care have truly set a benchmark in the field of obs and gynae. With a wealth of experience and a compassionate approach to patient care, Dr. Acharya has undoubtedly elevated women's well being to new heights. Her remarkable diagnostic abilities, coupled with her unwavering commitment to provide the highest quality of treatment and care, have earned her admiration and gratitude of countless patients. What truly sets Dr. Acharya apart is her extraordinary ability to connect with her patients on a personal level. The way she handles each patient with compassion and empathy and respect is nothing short of amazing, fostering trust and confidence in every interaction. And I'm very privileged to invite Dr. Acharya for the next discussion on how self care in female healthcare professionals can be cultivated. So, over to you, Dr. Veena.
Great, great. Good afternoon, everyone. Thank you so much for inviting me. Such a important and thought-provoking discussions because as a personal, I spent my life at least 40 years in the as a professional, as assistant professor, associate professor, professor, superintendent, and retired as a head of department. And what are the so many experiences which I felt how to balance personal and the professional life that is very challenging for we professionals. And for that, I just want to share few slides. And I think so because whatever they have discussed, it little bit different, and it is my own experience in day-to-day life. How we are cope up with this the problem to balance. It is easy to say, but when you are doing the personal and the professional, because the healthcare provider, as we all know, are the key factors. And in my lifetime, at present I am working in the Rajasthan hospital as a senior consultant and looking after the whole the department, preventive oncology and the menopause and the other department. And many patients are coming on day to day practice. And what I want, that whatever topic you have given, the cultivating the self care in the female healthcare profession, this is a very important topic which you have given to me. And I think it is a very important to bother about the health of the women who are working as a healthcare providers. That is the big thing. And healthcare provider are the key role player in maintaining the social health. That is the thing. So there is health is important not only for them self but also for the others. And cultivating the self care among the female healthcare professionals is the crucial for their overall well-being, then their ability to provide the quality care to the patients. So their health and their look after is so important. But can we do? Can we cope up with these things? It is very difficult because in my profession, when I am working in day in day out in Zanana Hospital as a gynecologist and obstetrician, doing 24 hours duties, and you won't believe everybody is saying women wellness is important from the birth to the adulthood to the menopause. Can we go for that? Because it is easy to say, but it is very difficult for the healthcare professional. And they are more bothered about the caring their family members, their partners, their children. So we say that they should take care first, as we all know in that aircraft. Oxygen mask पहले अपने लगाएं दूसरों लगाने के पहले. And we have the very beautiful dialogue by the Kareena Kapoor. मैं अपनी कद्र खुद करती हूँ. So this type of the dialogues are given by the Kareena Kapoor कि मैं अपने आप को look after करूँ. But can it be possible for the women? And this is that there are so many different steps which we are following. There are social pressure, physical, spiritual, occupational, that is very important, emotional, environmental. So there are so many problems for the working lady and especially the healthcare provider, and especially myself like the obstetrician and gynecologist. So in day out practice, we are suffering a lot in our health issues and anything. And really, as far as the mental health, we all know it is the state of the well-being that includes the emotional, psychological, and social well-being, and it affects our feeling, thinkings, everything. And it is important throughout the life from childhood to the menopause. And can we keep it balanced between our mental health? Because healthcare provider are so many problems associated with the emotional problems, behavior problems, family problems. They cannot be balanced all the things, and they are having the competition between other groups, because they are so many things in their mind to keep in so many ways. Lifestyle, because the chronic stress can give the negative impact both physical and the mental well-being. So that will lead to the anxiety, eh, or that will sometimes the behavior changes, anger. And it is very common in our present, because we are working day in day out, we don't find time to eat, we don't find time to go out, and we try to cope up with our all the activity quietly. And sometimes depression in healthcare women, which I observe in some time in my professions, that some women who are away from their family, away from their coming from their place, and they are so much disturbed and so much imbalance between their personal and academic activity, and sometimes they develop suicidal tendencies. So it is required proper counseling in their sleep disorders, so these are the problem. If you people see the doctors in above, but what we feel, which I am sharing with you people. And this mental stress means work stress, relationship stress, financial stress, how they cope up with the health stress, and the pregnant. Because the baby, just she has mentioned she's small baby. When doctor sometimes doctor do not want to produce the baby, because they don't they justify with them, and they refuse. We don't want, madam, any baby more, because we don't do the justify with our baby. We can't look after our baby throughout the day, throughout the night, because in the night we are busy, in the day we are busy. How can we cope up with all the things? So the mental health is bombarded by so many problems with the healthcare providers, and that lead to the sometime with the peer educations. They don't have the anything, and they are entangling in some other way, alcohol and tobacco. So these are the problem which we observe in our own groups. And in 2006, the survey that American psychologists say that women are more affected by the stress than the men, especially the working women, and more women reported the unhealthy behavior due to this. So they are always be try to cope up with this and this type of stress which we have. So even the hormonal imbalance in the women, that is also one of the cause of the irritabilities, stress, and this, and that is the they how to cope up with the personals and the family and then academic. So these are the imbalance between all the things. And we all know the brain is our lens of the world. Whatever we think, it is dependent upon our attitude and aptitude. In what way we are thinking, that is very important to look after that. So the positive approach is always be good, and the good counselors should give. So the individualness, it is individual perception to respond to the stress, and everybody wants the treatment, whether it is a healthcare provider or even doctors, sometimes so much depressed with their professions. So they all require the proper management of the timely. And lifestyle modification is everybody's talking, but can we find the time to lifestyle modification? That will definitely take the time, little bit time break for your own health and your own way. And the wellness is definitely between the harmony between the body and mind, and well balance between the nutrition, diet, physical fitness, and lifestyle and stress. So these all are the important things for the healthcare providers, and they should also focus on this. And what to eat, everybody is doing every day. We are discussing a lot about the fresh food, but we don't find the time. Sometimes they ask only, they have the food, but they don't have time to eat even the food, and they just call the somebody from the canteen, एक समोसा भिजवा दो, एक चाय भिजवा दो. That is the only time they get. And so you won't believe it, even they sometimes they say the big cardiologist doing the surgery, or the obstetrician doing the surgery for 2 3 4 hours continuously, and time has gone for this. So all affect their health, and there is a big issue for all this. So we don't find even time. It is very easy to say go for the morning walk, but we don't find 1 hour in the morning walk. So it is important that always healthcare workers we say, why don't you come in the lift? Go for taking the stair. Go for the parking a U way, so away from your vehicle, so you can walk little bit. So it is the small things which add your day-to-day practice and keep your health happy. And we all know the yoga and everything is also very important. That definitely change your lifestyle and give the positive attitude in your bodies. And all affect the cardiovascular, muscular fitness, improve your bone health, and that is the women is everywhere is same. Whether it's a healthcare provider, they are also the women. They also need all the things for their day-to-day life. They should also bother about their health and the manage their stress. It is not juggling everything, coping of everything in their day-to-day life. So there is jungling of the life, and they have to manage how to. That is the very important thing. And when we say healthy woman, it is your own attitude and aptitude. You think yourself as a healthy woman. I am a strong woman. I am a pure soul. I can do anything. I don't have any problem. This type of things. Once we charge mobile, we are many bothering about charging our mobile day in day out. Ki our mobile is charged or not. Why don't you charge your body for at least 5 minutes? Say something, stating some things that you are the strong one. You like yourself. You respect yourself. Develop the self-image, and that will give the confidence in you. And then you cope up with so many challenges in your day in day out practices. So that is the way. And the healthcare provider should also require all the screenings, not only for the others, for themselves also. And the essential screening tests are very important. Go for their blood check. Many people, many healthcare workers are hypertensive, diabetic, and they don't bother about their health. They are looking after the patients. They are looking after the others, but they don't look after themselves. So that is also very important. And the most of the healthcare workers are now in corporate hospital working from 9 to 6 in the AC room, and they are not exposed to the sun, and that is the most important cause of the vitamin D deficiency, and that's why leading lot many others problems. So that is small things they have to also bother about themselves and go for the simple test. Every woman should be screening by their profile every year with some test to keep. Why everybody thinking we don't have any problem, why should we go to hospital? If you will go and screening yourself, you don't have any problem. So the screening is very important, and you should know about your family medical histories, your other family members having any problems. Go and check up for all the things. It is my patience. I am doing the preventive gynae oncology, and I try to prevent the women from the cervical cancer, breast cancer screening doing daily. So no woman should be suffer from the cervical cancer, and both are the preventable disease and prevent when we treat them directly and timely. And there are so many methods to diagnose these things. And today I have on International Women's Day, I am giving the HPV vaccination to prevent the HPV infection, which is the cause of cervical cancer. This is the only vaccine, HPV vaccine, which prevent the cancer on almost 6 types of the cancer. So now I motivate most of the women for the vaccinate themselves and their girl child between 9 to 14 years. And that is the simple way of testing them. And these are the, so lifestyle modification, regular nutrition diet, regular exercise, spend some time for yourself to keep healthy and happy. And that is the way we eat healthy, be active, and manage stress and supplement wisely. Thank you so much for listening. Thank you.
Thank you so much, Mana, for your energetic and assertive speech. Really appreciate your inputs. And I could see that when the other panelists were speaking, you are still busy with the patients, taking calls.
Somebody's calling me.
So in between your busy schedule, you were able to do this for us. Thank you so much. On that, I would like to share an experience. I was having a discussion with one of our nursing in charges, who is one of my friends. She was telling that Varun, during COVID, there was a nurse who was working in the hospital, and she wasn't able to go back home, meet her husband and son, because all the time she was posted in COVID ICU. And while treating patients in COVID ICU, she herself got COVID and she got admitted in the hospital. So then, and unfortunately, this memory pinches my heart every day that she couldn't survive COVID. And her husband was being called to the ICU to do the formalities. And I was like, okay, who is with the son? He was a 10-year-old kid. And I ran off to the kid who was waiting outside the hospital. And the first question he asked me was like, sir, where is mom and when is she coming home? I mean, sir, it's been 10 days I have interacted with her. There I realized that it's just not a nurse. there are a lot of roles
Yeah, we
that
do not want
ladies
to
play.
remember that day, COVID times.
Yes,
Don't want to remember.
it
Families.
was.
My son, I have seen my son after 20 days when he was in the hospital duties because we have refused him. He didn't turn to the house for 20 and 25 days. So that COVID time we don't want to remember. It
I
was so
understand. Very
difficult and
difficult time.
very difficult time.
So, on that, let's open the forum for the question and answers. We can have a quick Q&A for the next 10 minutes, and then we can wrap up the session. My first question with Radhika. Uh, so, Radhika, women are often expected to balance multiple roles and responsibilities, including those within their families. How do you manage work-life balance as a healthcare leader?
I think no, that's a question that we ask ourselves, and I don't know whether we answer it rightly as well. I think Dr. Veena covered it beautifully, right? I think self-love is very important. I mean, I think it's been a revelation, especially during COVID, etc. Right? I think mental health, taking care of mental health through physical health, and I'm a big proponent of it. I run, I do my strength training. I need to do it because I need to keep sane. It's not to look fit or anything like that. That's not at all my motive. But it just gives me so much of mental energy and agility. I have a 10-year-old son. I have a family and I have to get to office every single day. It's a 6-day working. So I think it's about you finding the time. That time is not going to find you. I think I wake up at 4:30 in the morning. I have my schedule and I sleep by 9:30 in the evening. I have to do that, right? Otherwise, I won't get time to exercise. There's just no time at all. And I find the day I don't, nobody wants to be with me because I can just turn a bit of a shrew from that standpoint. So it's just the way you manage it. It's about discipline. It's about consistency, and I believe it works. So I think that conviction, women, I do my medical checkups, doctor. I do it every single year. My heart checkup as well as my other women checkup. I think that keeps me going, right? And I know for a fact I can go and say that I'm not ill at all. So I think you have to prioritize yourself, and there's no other shortcut to it. You have to be selfish here. So
Correct.
मैं
Can't
अपनी
agree
फेवरेट
more.
हूँ, that is the important thing. मैं अपनी फेवरेट हूँ, that is the Kareena Kapoor's dialogue.
Absolutely.
मैं
correct.
अपनी
Apne
favorite हूँ,
karta.
that is
Absolutely.
so
Yeah.
that is the, like, in our Indian women we don't bother really. In fact, we are discussing, telling everybody's, but still the priority is our other family members.
And Dr. Veera and Radhika, adding to that, whenever I see my mom, I mean, she's a working lady. When I see her, so she's 65 and still she do not, I mean, she's like continuously working. And whenever I say that, Mom, you
I'm
should take
70 plus.
medicine.
Doctor, I'm 70 plus. And
So,
since
ma'am,
morning 9 o'clock, after the puja and everything and International Women, I'm celebrating, and I'm still with you.
so, ma'am, I mean, that's truly inspiring. And whenever I ask my mom that, Mom, let's go for checkup, she's like, "Ek cup chai main pee lungi, and I'll be fit and fine. I don't need any checkup." So it's about them prioritizing. And she's
Yeah.
literally asking me, "Dekh, मैंने कहा था ना चाय पी के ठीक हो जाऊंगे." And I don't know what works. She actually, after drinking tea, she gets fine. So,
There's so many things, the spiritual things, emotional things, and their own willpower is very important. Previously,
true,
people are saying we are not
absolutely
going to the hospital. Why now everybody is require drugs? We don't require the drugs at that time. So they have very strong power. But still, I request everybody go for the
correct,
regular checkup.
true.
So you won't have any.
So my another question is to Ritika. So Ritika, we would like to know that what inspired you to pursue your career in healthcare, and what unique perspective do you think women bring to this field?
I don't think there was one moment of inspiration really. It's never like that, right? That you I think it might happen in other people's life that there's this a moment where they go, ah, so this is it. But for me, it was these small things, these little things that happened with me that nudged me towards thinking about patient experience, patient accessibility. Um, It started with my son. I don't know, it didn't start. It's just like it kind of accentuated when my son accessed Google Nest and asked something, and Google Nest replied, "Oh, let me tell you about periods. This is how it happens." And I was like, "Hang on, the technology isn't foolproof." And I was like, "What do we do about it?" So my father-in-law, my mom-in-law, my mom not being able to navigate the phone, things like these kind of nudged me towards what I'm doing today. And I'm deeply, deeply uh, inspired by the different problems that we see as of today. Uh, and that is why I'm here. I'm here in patient experience because I think the work that I would do is meaningful in different ways. And I think I will keep finding these reasons like in my day-to-day life, and maybe perhaps a big event where I go, yeah, that's why I went about it. I hope that answered. That's a good question, and for you. And
Absolutely.
to answer the second half of the question is like what women can bring into this field is definitely perspective. Um, there's and any perspective. It's not just about women's perspective, a kid's perspective, a perspective of a woman who is differently abled, a perspective of a woman who is a homemaker. Any perspective that comes in is bound to make a difference, which is meaningful. And I think women have this great capacity where they bring together a lot of chaotic and I would sometimes say even contradicting conversations on one table and are able to still make sense out of it. So I think that's what us women can bring in, um, of, not just our voices, but everybody else's voices also.
Absolutely. Thanks, Radhika. My next question is to, I promise all the respectable panelists that I will not take much long. Prachi, my next question is to you. So, a study indicates that gender diversity in leadership positions lead to better organizational performance. Oh my God, that's a really cute baby. So Prachi, are you okay? You can skip this
Yeah.
question. That's
No, no,
absolutely
I'm fine. I'm fine.
okay. So in your experience, Prachi, what unique qualities do women bring to healthcare leadership role?
Well, I believe that women provide more emotional support. They are more compassionate. They are more empathetic. Women are more prone to avoid conflicts when it comes to workplace or home. I believe that women have more adaptive leadership. They are more multitaskers. They are very good at collaboration and teamwork, and I think they have more adaptive leadership qualities. They have more emotional intelligence. So these all qualities I think are required when it comes to a healthcare leadership forum, because as far as all these factors are concerned, they not only balance out the team, but they also are more beneficial to patients as well.
Thank you. Thanks, Prachi. And my another question is to Dr. Veena. So, ma'am, you already spoke about to balance the work life, some lifestyle tips that you have already given. My another question on that front is, ma'am, what are the common healthcare problems that you are witnessing in female working professionals? Because I could see that nurses, especially, someday they are doing the morning shift, someday they are doing the night shift, evening shift, so their biological clock gets disturbed. Even I have seen that they suffer a lot of hormonal imbalances, their appetite go for a toss. So what are the common problems that you have witnessed by healthcare
So
professionals?
previously, when I work in the government hospital, most of the nurses are coming from the Kerala, and there are the lot many problems about the eating habits. There are a lot many problem of the nutrition. Plus, their environment is like that. They are not adjust with everybody's, and that lead to their so much depressions in that time. They leave their job in between, and they went off. and they are really very sincere workers. They are working day in day out and night sleeps. Even myself, if you ask us, most of the doctors who are doing the residency times at the age of 28 or 30 years, that is the age most of the women are enjoying their marital life or their motherhood life. They don't want to be a mother. They're so much depressed and say, madam, I can't do the justice. They are not going for the marriage also. They are not going for the baby. They are not going for then because they are under such a stress because they are not cope of their professional duties. So that affects their day-to-day out life, and sometimes they feel why they have chosen this profession. So that is also sometimes feel, and that lead to the mental stress to them, and that gives the negative impact on that, and that is the cause of the stress leading to the lot many problems, high blood pressures and this. So that's and sometimes you won't believe they don't find the break, because some, if they have the break and other sister is on the leave, again they have to do the duties day in day out. Even in the labor room duties, if she's on the labor room duty night and day, in the morning she has to come in the hospital. So they're all things imbalanced. Physically they are imbalanced, their morning activities imbalanced, their day and day out activities balanced, their food habit is entirely changed because they don't have time to have the warm and healthy food in the day and day out, because they don't have time to find out because the long working hours. But even then, after some times, there is now a little bit changing. I'm the witness for changing because I am spending at least 40. Now that shifting time is changing. It is not at 24 hours or 16 hours. It is going to be 12 hours changing. Then it is now it is 8 hours changing hours. So it is improving day and day out, and then a lot of changes are going on, because in my time 24 hours duties is there, then 12 hours, now it is 8 hours. So it is coping of the duties, and people are little bit, and break is also giving. Previously there is no break in between. So now the professionally also everybody is realizing, and we people also recommended for their comforts. This is not the, it is, they are a human being, they are not unhuman. Other way you are treating as a healthcare provider and on, you are not looking after them also. So that is the big problem. And I told, if we ask our colleagues how many underwent for the mammography, how many underwent the pap smear, we find only 2 or 3%. They don't find time for themselves. So that is the big issue in the healthcare providers. And now the time is key for the relaxation. I had also changes after the my lot many academic and activities, and the changing the social work. So that is also giving a lot of relaxation. Now I'm moving the teaching in the schools, giving the knowledge to the girls, then the women association, empowering them, giving the knowledge to them. What are the physical, how the adolescent going to develop? What are the problems? So knowledge and spreading is another relaxation for the healthcare providers. That will give the good relaxation. At least one, this is my experience, what I'm doing now.
Thank you, ma'am. One last question to all the four panelists. I would like to, and anybody can answer that question. So, research suggests that diverse leadership team leads to better outcomes. Can you share some example of how diverse leadership has positively impacted your organization? How leadership roles of women has impacted and brought perspective to your organization, be it Rajasthan Hospital, be it Rainbow Hospital, be it Athena Healthcare, be it Anand Surgical. And can you talk about any initiatives that are being taken to uplift women in your organization? We would be happy to hear about it. And on that, we can close the discussion. So over to all the panelists. It's an open question, anybody can answer.
I'm happy to go first, Varun. Honestly, at Rainbow Children's Hospital, we don't have too many women leaders. That's the fact of the matter. So what are we doing about it? We are definitely conscious that we need to build it because we're doing well and we can do better with better diversity, right? And that's the power of, having the diversity itself in whatever form, persons with disabilities, LGBTQ, all of those things. Specifically for women, we do have an agenda. We are launching our inclusion, diversity and equity campaign. In fact, we've done two rounds of meetings with the leadership. We'll be building a campaign for inclusive leadership as well as a certification, and then we will translate that down below. And this is something that we are consciously doing. There is a lot of support from the board. There is a lot of support from our senior leadership. So I think we need to get the ball rolling. We are in a good place, the good point of inflection for us to do that exercise. And maybe same time next year, I'll have a better answer with respect to the diversity ratio from our hospital. Yeah.
Thank you. Any other panel member would like to address the question?
Yeah, I can go next. I think at Athena Health, inclusivity is celebrated. We have an inclusive leadership, and we have an assigned a role who's our inclusive officer, and they basically make sure not just women but people from all walks of life are present in decision making, in research, in product engineering. Um, and and Athena Health I've seen is very accountable. They also make sure we have gender sensitive hiring. The numbers are reported in every 3 months. There's a company meeting and they would release the numbers of women that was hired, and they would also segregate it, the numbers by entry level versus the leadership. So the leadership hiring and what's the ratio, and I guess at Athena Health, this is a very personal story, but for out of my 15-16 years of experience, my first 10 years were not I was not paid for the men were paid. So I always had a gender pay gap that every woman is facing. And Athena Health is the place where I got my first, my pay for the first time as per my skill set and not my gender, or that I'm a mom, or that I, need to work from home 2 times or 3 times a week. So yeah, that's from my side.
Thank you for bringing that up. Dr. Veena, any final comments from you, Ms. Prachi? Anything you
I'm
would like
totally
to?
agree with the Radhika on this because diversity is very important for the better management of the hospital outcome, because we have the different attitude and the different opinion from the different persons, because the single leadership does not help in, because in our hospital at the workplace we find lot many problems associated with the females, and they are shared by the leadership who's working there. So there is a good way if we have the diversity of this, and that will definitely improve or the important for the hospital management. I am totally agree with both of them.
Thank you so much, Ritika, Radhika, and Dr. Veena. Prachi, any final comments from you before we wrap up the discussion? Anything you would like to mention or add?
No, Varun, right now I cannot. Thank you so much.
She says, thank
Thank
you.
Yeah.
thank you.
Thank you.
So on that note, we'll wrap up our today's panel discussion. So on behalf of entire team of MedLearn, I would like to extend heartfelt gratitude to each panelist for your perspectives, for your contribution that you shared during today's discussion on International Women's Day. Your expertise and passion have illuminated the vital role that women play in shaping the present and the future of various industries. We are deeply grateful for the time, wisdom, and commitment to fostering meaningful dialogue and progress on this important
Yeah.
occasion.
And to
Thank you.
the object or the aim of this international is invest and execute. So investment is the time or the money or then the what way we are investment
True,
and then execute. That is the
true.
more, all the things are very important. Thank you
Thank
so much.
you. Thank you, ma'am. Thank you, everyone, all the participants and all the panelists. And let's be the champion of change. And I look forward to similar insightful sessions in future. I wish you all a very happy International Women's Day once again. And stay healthy, stay blessed. Thank you so much.
Thank you. Thank you.
Thank you. Thank you.
Thank you so much. Bye bye.
Bye bye.
Thank you. Bye.